Well, hello and welcome to the Q&A session for our second and final governance webinar in round 2 of the NDIS Success program. Today we're going to talk about strategy, risk, impact, and also touch on governance. First of all, Community Business Bureau acknowledges the traditional owners of country throughout Australia, and we recognise their continuing connection to land, waters, and community. We pay our respects to them and their cultures and to elders past, present, and emerging. My name is Andrew Ellis. I'm a business consultant with CBB. I'm here today with Jane Arnott, who's General Manager of Consulting and Business Services at CBB. We are coming to you across 2 different locations, filming from Adelaide's lockdown at the moment, and we're both on lands of the Kaurna people here in Adelaide. So today we're looking at questions that we've been asked since the Strategy, Risk and Impact webinar went live. And we'll try to answer the questions that we have to the best of our knowledge, drawing on our experience working with around 100 providers who've transitioned to the NDIS and our ongoing support of other NDIS providers. So in terms of today's webinar, we've grouped our questions into 4 different themes: strategy, impact, risk, and governance. So we might get things underway.
Cool, thanks, Andrew. So one question that we get asked quite a bit actually is we're planning a strategy day for our board or management committee to develop a new strategic plan. What are the things that should be on the agenda?
I think this is a great question. It is one that we get quite a bit. Workshops need to be planned for, and it's important to do homework beforehand on those sorts of things, looking at what information you might need, what do you know already, what do you need to research further, and who needs to provide different bits of information into the meeting. And all of that's really important to ensure that you get a good understanding of the market and the external context that you're operating within. I guess also inbuilt within that is just understanding the internal context of different KPIs or issues or skill sets, capabilities, weaknesses, those sorts of things going on in the organisation. In terms of having the actual workshop, it's always useful to start with some ground rules and identifying what people want to get out of that session. It can often be useful to do a refresh of your vision, mission, values, just to help centre the conversation and the purpose for the day and purpose for the organisation, just in getting that workshop going. It's also useful to have the previous strategic plan and to know what you've achieved or not achieved and the reasons for that, because that can set some important part of the context. It's always great to have some discussion around your strategic planning process and to have clarity on how that process works, from the planning to how it links to like an annual plan, how it links to the budget, those sorts of things. As with any board meeting, you'd want to have any discussion papers and things like that out to be read before you get into the meeting. It can be useful to have presentations either from management or guest speakers, whether that's on topical key areas of interest to your organisation at that point in time, or about key issues, challenges, growth opportunities, those sorts of things. So there's a lot of information there, but I think there's a lot of value in doing those sort of strategy workshops and planning days, but it's important to plan for them.
Absolutely. And in terms of, trying to do that strategy day yourself or using a facilitator, what are the kind of pros and cons of either sort of self-managing your strategy day or perhaps bringing in a facilitator to support you?
I think just starting from the disadvantages of doing that, usually that will come with a bit of a cost of who the consultant is and that sort of thing. And assuming you have someone with sector knowledge, then I don't think that there's, too many other disadvantages. There could be a disadvantage if you've got someone who's less familiar with the organisation, but I think mainly there's advantages to having someone external involved with the process and helping to facilitate. It does give everyone, board and management, whoever's present, the ability to sort of think as part of the workshop and contribute rather than needing to think as the chair or the facilitator of it. Gives quieter board members an opportunity to contribute as well. And you can draw on the unbiased external perspective that facilitator brings and their insights as well. Being able to ask some questions that get to the heart of the matter, where sometimes organisations might not go straight to that. They might dance around things as well, politically or otherwise. And that can help bring some additional structure on the day and to any of the papers. So overall, we think it is worthwhile having an external facilitator or somebody come and chair that session for you.
Yeah, absolutely. And then how about, sorry, I'm being very distracted here. How about how often you should do a strategic plan and how long it should run for?
Yeah, so I think most Western organisations and Australian organisations probably work on a multi-year strategic plan being over 3 years. I've seen some go out over 5 years, but I just think there's so much change that happens in the world in that period of time. It's hard to plan for that sort of time period. And I think I see two different types of organisation. One who will put the strategic plan in place for a 3-year period and then almost set and forget it and then come back in 3 years' time to look at it again. Other organisations will have it as like a rolling 3-year period. So you might do a rolling 2020 to 2023 strategic plan now, and then in 12 months' time come back and move it forward by a year from to 2021 to 2024. And I think that's a good way to refresh. You can update what's working, what's not working, and keeps it relevant as well as the market conditions can change.
Yeah, I think it's a really interesting one because obviously the NDIS is a very fast changing environment. So, for providers being able to have that flexibility, but also we know that, depending on the size of your organisation and the amount of change that you're trying to manage and the pace of change within your organisation, it might take you a long time to actually get to the position you want to be in. So I think it's always worth having your kind of ambitions might have a longer term horizon, but your actual strategy probably needs to be quite focused because it's really difficult to plan on a 5 and 10 year horizon at the moment, particularly with all of the kind of changes that we've had certainly in 2020. Okay, so
Absolutely.
Those of us that are kind of familiar with the not-for-profit space are probably, perhaps a bit more used to using theory of change as a strategic tool, perhaps. Can you just give us a bit of a sense of what a theory of change is and whether organisations should have one?
I think it is important for organisations to have, and particularly if you get more than just a small organisation, but it is definitely an important part of understanding how you realise your purpose and how you achieve your overall strategic aspiration that you're trying to work towards as part of your vision and your mission. So the theory of change is about demonstrating how different parts or aspects of the operations contribute towards the overall impact you want to achieve in your community. And most for-purpose organisations, not-for-profit or for-purpose organisations, could make more use of this theory of change model in their strategic planning. It's about making sure you understand the changes that you're trying to achieve and how you want to go about getting there, and any preconditions that need to be in place, who else in the sector that you need to be working with, those sorts of things that can help you with not just providing service. It's a little bit like the conversation we'll come to later about impact. The theory of change is around how you're achieving that impact and how all the different activities that you do combine together to achieve what it is that you're wanting to. I don't know if you want to add to that one, Jane, from your experience as well. But.
Yeah, I mean, I think theories of change can be really complex, so I've seen some amazing ones that people have invested a lot of time in to really think through all the different factors of the external environment, the stakeholders, the assumptions that they've loaded in. So it can be a really, really thorough piece of work, and certainly if you're a really impact-focused organisation, then I definitely think it's worth exploring that kind of model. And it should be, there's different terminology for it. So sometimes it's described as a story of change as well. And it really should help people to understand the connection between the services you're providing, the activities you're delivering, and the change that you're trying to create for your community. So I'm a big advocate of theory of change, but it's really about choosing the approach that's best fit for your organisation, not over-engineering it. But if you're a large and complex organisation, you probably do need a large and complex theory of change.
That's good.
Talking about complexity, how many goals or objectives should organisations have in their strategic plan?
I'm not sure that there's one real precise right answer here, but I think, you know, definitely it's possible to have too many, and I have seen a number of organisations where that's the case. If you end up having something like 7 overarching goals, and then each of those have 5 objectives or initiatives sitting underneath it, then that starts to get you up to 35 different things that you need to measure, and it starts to become a bit meaningless. And what's most important, those sorts of things, it's a bit hard to figure it out. So I do think it's important to keep simple, and any more than having any more than 6 or 8 goals starts to be too much, and you don't have enough focus. So I guess if there's a righter answer, I would aim for about 4 or 5 goals. But whatever number it is, try and keep it simple. Get it down to just the most important things that are really the most critical for your organisation.
Yeah, and I think, you know, remembering that your strategy is both an internal and external communications tool, and if you make it too complex, then your staff start losing touch with what it is you're trying to achieve. So we've definitely seen some kind of mammoth strategic plans which people then can't deliver, and that's disheartening as well. So keeping it realistic is really important.
Absolutely.
The other factor, obviously, in an NDIS market, it's all about choice and control. It's all about being person-centred. So how should NDIS providers involve customers and perhaps other key stakeholders in the strategy process?
Yeah. Well, I guess depending on the ownership structure and things like that of the organisation, if you're a not-for-profit, you're likely going to have a board. And so, you know, some of those members or customer segments are going to be represented through people that you have on the board, and so they can be involved in decision making that way. But I do think it's important to get a wide range of opinions, so that you don't just get an individual perspective, you get a group perspective. So there's other ways that you can get that through surveys, market research, focus groups. You could conduct your own sorts of surveys or focus groups, or you can also look at the data that's available from a market research perspective from organisations like the NDIS or other peak bodies. And I think as well, I know that we're talking focused on NDIS and disability, but many NDIS providers are also working in other adjacent sectors such as aged care, and they have, through the quality safeguarding arrangements in each of these different sectors, they have slightly similar but different requirements that often come up of having like a customer advisory group or a participant advisory group, and those concepts play out in different ways in different parts of the not-for-profit sector. But those sort of advisory type groups can also be quite important to bring together a representative group of your customers or your NDIS participants, and they can provide input to, you know, different operational things within the organisation and new services you might be looking at, issues that come up. They can be that canary in the gold mine, so to speak. They can be, you know, the part of your early identification of some of those issues if you've got the right relationships and the right representation in a group like that. And they can also help you to operationalise your strategic plan. You might have a direction that you want to go in, a type of service or whatever it is that you're wanting to deliver, and those groups of people can help you to sort of fine-tune how to do that best and how to be the most effective. So I think they have an important kind of governance role and an important role in, you know, feeding ideas into the strategy process as well.
Great. We touched on this a bit earlier, Andrew, but we do have a lot of change in the NDIS market. Price guide changes regularly. You know, Disability Royal Commission will affect things as well. How do organisations ensure that their strategic plan remains relevant in that kind of changing environment?
So I think the discussion is really important, whether it's at the executive team or management team level or at the board level, and having you know, there's so many topics that we end up with as a fairly standard agenda item, whether it's work health safety or something else, customer complaints, for example. But having the idea of market changes or new and emerging risks, I think, as well, is a bit related. Having those things as a template part of your CEO report to the board, or as your part of your management team, executive team reporting as well, I think are really important. So that way you can flag on a monthly basis, quarterly basis, whatever your board and management team are meeting, you can start to flag and identify those issues that are, where is the market changing? So I think when you do that, it becomes part of the conversation. And I think as well, if you're looking at and measuring progress on, say, a quarterly basis, sometimes more often against your strategic goals and objectives, then putting those two elements side by side creates a discussion around whether the current goals are still realistic, whether they should be, new ones added or changed, or maybe the goal is still correct, but the timeline needs to change, and you can flex those things as you need to there. So I think even, if you're 6 months into your 3-year strategic plan, it's still all right to change it, though you don't want to change for change's sake and do that too often, or it becomes a bit of a meaningless document. But, if the market shifts significantly enough, then the plan should adapt through that process.
Yeah.
So we might move on and talk about impact now, and probably this flows a little bit. We're talking goals and objectives, and now I'm going to talk about KPIs. So, Jane, what KPIs do you think we should use to measure our business performance?
So I think that the key thing is, we've been talking about strategy, we've been talking about impact, and you really need to link your KPIs back to what you're trying to achieve. So, the purpose of your KPIs is to tell you if you're heading in the right direction, both from a impact perspective, where we're delivering the things that we want to, but also from a business performance perspective. So, are you on track from a goals for your organization, be they financial, related to customer numbers, etc., etc. So linking it into that kind of longer term view is really important. So making sure that you're measuring the things that are important to you as an organization. And then I think it's really looking at, what are the critical things within this market, if you like. So safety is obviously a really key concern for disability service providers, making sure that your customers are safe and that your employees are safe as well. So safety first and foremost, and I think linked to that is really understanding the kind of quality measures, having your audits and your customer feedback and complaints and your improvement initiatives. So really tracking what's coming through your policies and procedures, in terms of your complaints and incidents reporting, looking at that stuff, looking at anything that's come back from your audit as areas of improvement and tracking how you're performing against those. Obviously, there's financial, so we'd expect organisations to be looking, at a minimum at a range of financial indicators around revenue, income, profitability, standard stuff around performance against budget, but you might also be needing to look at things like cash reserves, levels, ratios, those kind of things, depending on your business. Thinking about your market and how much your business has grown, just think about that from a perspective of growth in the market generally. So it could be that you've grown by 10%, but actually if your competitors are growing by 50%, is 10% a good outcome? It might be a conscious decision to stay small so that you can maintain a really personal approach with your customers, but making sure that your growth measures and things like that are in that context of the market. And similarly, looking at how your other measures are affected by change. So if you're measuring things like new customer numbers, customer retention, particularly employee indicators, you really need to look at that in the context of the entire organisation. So, for example, I did some work with a client last year where we were looking at some of their HR KPIs, and board was looking at the number of missed shifts, so drop shifts, and that obviously had an impact on the service level to the customers. Now, looking at raw numbers, what it showed was the level of drop shifts was increasing, but when you actually looked at those against the total number of shifts, it was a very different picture, right? Because the business was growing, so you'd expect the number of shifts that were missed to grow with it. But so it's all about looking at percentages and perspective.
Context.
The context is really important. And we would also suggest looking at trends over time. So thinking about, how your KPIs fit within the context of your organisation and your market, but also how they're trending over a period of time.
Yeah, absolutely. So we've got some examples of how we can measure impact then in the organisation.
Yeah, so we've talked about theory of change, and your theory of change should really, when you're looking at different aspects of that, it will talk about the outcomes that you want to achieve, the outputs in terms of the deliverables. It should have activities in there, so the kind of services that you're going to provide. So that will automatically lend itself to giving you some indicators. Understanding the customers in your community is really important. So one of the things to really consider with theory of change is you're not just looking at the reporting from your own organisational perspective, but also thinking about what that means for your customers or your clients or your community. So just by way of example, if you like, from a CBB perspective, when we deliver programs like this, we're not just looking at, how many people did we engage in the program, but we're also looking for feedback from people that have engaged in the program around, has their confidence increased in dealing with an issue? Has their knowledge increased? Those kind of things. So what's the difference that's been made to your customers and community? And obviously within the NDIS context, there are a range of outcomes that people will have in their plans. So you can use those as your indicators. So have you helped people access employment, increase their independence in the home around things like cooking and cleaning, increase their community participation, and think about how you use your CRM to record that. And you can be using, don't have to just do surveys. You can seek feedback directly from families, from customers, use videos, a whole range of things that you can use to help you look at those outcomes. And thinking about some of the proxies as well. So are you seeing an increasing number of referrals, for example, from existing customers or from other agencies that they work with, which would be an indicator that people are happy with service and feeling that it's making a difference. I think the key thing around impact is that it can be absolutely enormous. So, we would tend to recommend that you start small, start with the simple stuff that you can do really easily, gain your confidence and your experience in measuring impact, and then build from there. So don't try and boil the ocean. Start with something a bit more accessible.
More manageable, yeah, absolutely. That's good.
So Andrew, some questions on risk, which is your specialist topic. So can you just give us perhaps a bit of an overview around the types of risk that should be discussed at board level? Because obviously it's easy to take everything, but what should really be the focus of the board?
Yeah, I think many organisations, when they sit down and put a risk register together, it ends up as 50 items, 200 items, 300 items, whatever it is, and many of those are going to be operational things and are going to be, have controls in place throughout management and staff levels. So the board don't need to be, across all those sorts of things. I'd say, through that risk register, you'd end up with ratings or rankings, and you probably want the top 6, 8, 10, no more than that kind of risks to be those major or critical risks to be on the board's agenda. And I think also there's those risks where the board is an owner of the mitigation plans or an owner of what needs to happen with those risks. So, if the nature of the organisation and the board or the CEO or something like that is that, the board succession plan is a really critical issue and risk that needs addressing, then those sorts of things would sit within that list of risks that are discussed at the board level too. We touched on this in terms of market changes around strategy, but I think new and emerging risks should be a template, part of the template that is normally used for reporting to the board, and part of the exec team discussion as well. So changes going on at the moment, like the Disability Royal Commission, market changes on pricing, within your sector, part of the sector, there might be competition changes, things like that. Those sorts of new and emerging risks, there might be 1 or 2 or 3 of those each month or each board meeting that bubble up to the surface that are worth having a look at and talking about as well. And I guess just in the context of this, talking about risk at the board level, your organisation might have or might also look at the use having a board subcommittee that's focused on risk in more detail
Yeah.
and reporting back to the board. And I think from my own experience around that and conversations with organisations in the last 3 to 6 months even, I think as clinical and service delivery risk is getting more and more attention through royal commissions that have gone on, I think there's a bit of a move that I'm starting to see from organisations to take risk out of what might be part of a finance audit committee, and to stand up a standalone committee for risk. And so those sorts of committees, you know, are worth involving in the process for how those risks are discussed at board level too.
Great, thanks, Andrew. We're both getting distracted by phone calls coming in today, which is not ideal. How do you keep operational risks out of the boardroom? You know, we talked about discussing risk at board level, but it's very easy for that operational stuff to creep in. So how do you keep that at operational level?
I think once a year it is good to table that full risk register to the board, and as part of that to have a look at the preventative measures that you've got and, you know, things that you're doing to mitigate those risks. You also look at the ownership and responsibility of each of those risks. So I think maybe once a year it's worth flagging that, and then, you know, as board members come and go, that gives them an opportunity periodically to be able to see the robustness of what it is that management have in place. Without getting into the detail, they can get a sense of how much does sit there that management are doing. Yeah. I think, as we talked about, focusing on those strategic and critical risks in the reporting is important and part of it as well. And I think the other thing is, if operational risks aren't dealt with, then that in and of itself can become a strategic risk. And you know, the board is responsible for risk oversight, and they need to be confident that those risk management processes are in place operationally and being implemented. Yeah, it's just having that confidence, I think, is important, and then the board can definitely stay at the strategic and at those critical things. Yeah, I think that's probably answers it.
And so the other thing at board level, I mean, you talked a bit about clinical risk. I talked a bit about the quality and safety issues. So how does the board really, you know, effectively prevent abuse and neglect?
Yeah, I think this is, you know, COVID's probably been the major word and major theme of 2020, but I think this has been, you know, the next most prevalent underlying risk issue for NDIS, aged care providers, that sort of thing. There's a lot of discussion going on. How do we govern to protect vulnerable people? So, you know, I think at a board level, it's important to follow what's going on in the royal commissions, to keep an eye on, you know, even the aged care. We're talking NDIS today, but even the aged care royal commission, because I think there'll be transferable findings and things that will, you know, themes that will relate from what aged care and even into the disability royal commission. It's important to keep in touch with those sorts of things. I think at a board level, it's about having confidence that you've got processes in place around screening of workers, around the way that the services are delivered, complaints and incident registers, and not just focusing on the number of complaints or incidents, but looking a bit more deeply than that and ensuring that, you know, actions are dealt with. There's a continuous improvement program. I think that's really important as well, just knowing and having a culture of continuous improvement in the organisation as issues come up through whatever means it is, a near miss, an incident, a complaint, to know that systems get updated and changed as they need to in that process as well. I think as well, keep in mind, if you've been in the market for a while, been providing services for quite some time, then there is a chance your organisation could be called to testify at the Disability Royal Commission, and we're starting to get dates about that now, and that's going to happen next year. And so you need to have your own records in order to be able to submit that potentially at short notice from those who've been through processes like that before. So I think that's an important thing for the board to be across, is just knowing that you've got good records in place, good reporting in place that you can review and stay on top of.
Yeah, and we are hearing from other disability service providers that they're putting in place, dedicated resources to pull together some of their information for potential Royal Commission submissions. So definitely preparing for that.
So we might shift gears to our last topic for today, which is governance. So Jane, what sort of induction do you think, the boards should go through then?
So I think there's kind of induction at two levels. So one is really about the board understanding their role as a board member, and some of that kind of legal context, if you like. So really worth looking at some of the resources that are available from AICD and from the ACNC if you're a not-for-profit, Australian not-for-profit. So really try and make sure they understand their role as a board member, particularly if that's a new thing for them. Then you've also got to obviously do the induction to your organisation, so them really understanding about your organisation and the market that you operate in. So we would always recommend that people have a formal process, so a bit of a checklist of things that you want the board to go through. There certainly needs to be meetings of new board members with the CEO, and we would also suggest with the executive management team, so that they understand the different areas of responsibility and the different aspects of the organisation, both from a service delivery perspective, but also from a kind of internal corporate perspective as well. Obviously, they need to meet with the chair, and then probably with the board secretary as well. And that could really just be some of the logistics around board meetings and how they're going to engage. They need to understand the board processes, so how your agendas, papers, minutes, all that kind of stuff works, and anything around the committees that you might have of the board. So talked a bit about whether you have a risk committee or whether you have kind of people dedicated to clinical governance. So really understanding what the different structures are within the board. And having access to key documents, so making sure that they do have access to your constitution, your annual report, your financial reports, policy, strategy, etc., etc. Depending on your organisation, you might have code of conduct or other policies that relate specifically to the board, so ensure that they're across those. And then the other thing, I mean, you mentioned continuous improvement just now, Andrew, and I think that's something that's really important to consider around board inductions. So I think it's really worth getting feedback from new board members around how effective their induction was at helping them to understand the organisation. But also, as you're going through board meetings, looking out for those things that maybe you're getting a sense that the board perhaps doesn't understand something about the way that the organisation operates, or isn't across a policy, or isn't familiar with the strategy, whatever it might be, will help you to think about, what are the things that you need to put in inductions going forward, so that you're constantly looking at what else you need to add in.
I've seen a couple of organisations have an exit checklist when a board member leaves, and one of the questions they asked was, how good was the induction? But I think that misses the point, because so often that person says, well, that was 6 years ago and it's all changed since then. But it's probably worth checking back in with the new directors after they've been on for about a year, just to say, with what you know now and what you learned through the induction, could we have done something different back there? So that segues a little bit into what I think is our last question for today. So we talked about induction for like a new director, but what about ongoing training for the board? What sorts of things should be looking at or thinking about there?
Yeah, absolutely. And I think, again, as you mentioned, it could be 6 years that somebody spends on the board. And if you don't have limitations on terms, it can be, a lot longer. So it's really important to think about what will people need on an ongoing basis. You can't assume that you just bring somebody on the board and then they'll get all the learning that they need just from that board engagement. So I think particularly in this context of the NDIS, we should be looking at the updates they get on market changes. So, how frequently is the board being briefed on what's going on in the NDIS market? And that could be presentations from people within your team. So it could be management presentations and briefings, but you might also want to bring in people externally to the business to help people understand, help board members to understand some of the contextual stuff. But very much keeping, them up to date with the service delivery and the business, not necessarily getting it operational, but helping them to understand how that might be changing over time. And I think that's something that's quite tricky sometimes for management teams to work through, because obviously you're living it as managers and you're working through those changes, and not necessarily appreciating the impact that might have from a governance perspective. So I think really kind of having a stock take every now and then to just think about, well, how has our organisation evolved and what do we need to get the board across? Under the NDIS, the board really does need to be across the code of conduct and the practice standards for the NDIS, so really making sure that they understand that. And it's probably one of those things that even if you do an initial briefing on, it's worth revisiting periodically just to refresh people on what the implications are, and the metrics they need to see in relation to your NDIS registration. So and even if you're not a registered provider, you're still expected to have procedures in place for complaints and incidents reporting. So making sure that the board understands and is across what's in place and that they're seeing the regular updates. And then again, we talked about that governance knowledge. Again, things change, legislation changes, financial reporting standards change, all of those kind of things happen. So it's worth just looking at ensuring that they've got good current knowledge of kind of governance practice and best practice. So sending people for refreshers and things like that, or looking at whether you need to do some training for the full board, just to make sure they're across, what current governance practice is.
Good. So much to keep on top of, really, as directors, and it just all keeps changing. So yeah, so important to have that continuous, professional development as part of. Absolutely.
And and you're putting your directors in a position of a lot of responsibility, and there seems to be some increased practice now about directors being paid, but a lot of them are still volunteer boards. So really do have an obligation to make sure they're properly briefed to do the job that you've brought them in for.
Yep, absolutely.
Okay, so that gets us to the end of our questions for today, and that's actually the last of this governance webinar program. So we've had a couple of webinars and a couple of Q&As in this aspect of the NDIS Success program. So if you haven't watched any of the previous stuff, then pop onto our website and you can look at the work we've already done. But thank you for watching this program and the NDIS Success, engaging the NDIS Success program. We do encourage you to join our LinkedIn group, so we will keep that live certainly through into 2021, and to contact us at ndis@cbb.com.au if you have any further questions or if anything's unclear. Thank you. Take care.